California's nurses say that not one hospital in the state is ready to treat an Ebola patient. Meanwhile, Governor Jerry Brown said officials are working at ensuring medical providers are prepared to handle Ebola patients. Michael Jackson, a UC San Diego ER nurse and vice president of National Nurses United, is here in studio with me, along with Dr. Thomas Novotny, medical epidemiologist who teaches global health at San Diego State University. Michael, how are California hospitals unprepared to treat Ebola?
Well, the CDC guidelines have changed so much over the past few weeks. It takes time to catch up and get the training and get the appropriate equipment. As of yesterday, the new guidelines came out for no skin exposed. So it's an expanded PPD. There needs to be time to train upon this PPD. We're saying that it needs to be robust training with the team approach, you and your buddy. Because no patient is cared for alone. It's a team approach.
And Thomas, what does full preparedness look like for a hospital?
Well, first of all, they have to know the disease and make sure that the staff are fully briefed as to what the risks are. And with the CDC guidelines, now there's improved protective devices that are being recommended and better rituals in terms of putting them on and taking them off, and with careful monitoring overseeing that process. And so there's clear guidelines now that are certainly much more detailed than they were previously. It's not enough to just hand out a brochure or put up a website. It's important to do training that is drilling on these procedures so that they're done correctly.
So there are guidelines. They've recently been issued or updated. How much can one expect uniformity across hospitals given how recent these guidelines were issued?
Well, I think it's up to each hospital to assure that uniformity. They are required under the Joint Commission on Accreditation of Hospitals to do certain things in a uniform way, and Ebola is a reminder that infectious diseases are a threat currently and that they can actually do this correctly. They're not legislated to do this. I mean, CDC's authority is not that of a regulatory agency, but the guidelines are very clear, and I think now people are pretty sensitive to it, so I think we can expect it.
Michael, Governor Brown met privately with nurses and other healthcare providers to discuss Ebola. What was said at that meeting?
Well, the governor assured us that he's going to be in working mode. He's going to be working with health officials from his cabinet to get out some uniform standards and to put California on the forefront. Because you know, California is the largest state in the nation with its population, and we have the largest amount of nurses, over 400,000 in the state of California. So he assured us that there's going to be some work and some planning that's going to go forward.
So, Thomas, the California Hospital Association disputes this contention that hospitals are not prepared. They say, look, you know, we're prepared for emergencies, disasters, and infectious diseases. We're prepared for this all the time. Does he have a point?
Well, they are prepared, but perhaps they're not prepared enough. And I think, you know, it's important to look back on what went wrong with other places and to make sure that those gaps don't occur here in California. We should be in a leadership position, for sure.
Now, the State Department says the threat or the risk of Ebola in California is pretty low. Do you agree?
Yeah, I think it's pretty low. I think it's pretty low in general. They've taken some steps now to make sure that people coming from West Africa go through certain more standardized screening facilities, and that's going to be good. More than 90% of the visitors will come through those, and they'll be monitoring people more carefully. And I think the projections are it's only going to be 2 or 3 cases, perhaps, that'll get on planes and come to the United States from each of those countries.
And Michael, what's next for nurses in terms of this topic?
In terms of this topic, we're going to still keep pushing our message. We're doing a petition right now on our website, nationalnursesunited.org, to have the president set forth national mandate to hospitals, because like the doctor here says, CDC is not a regulatory body that they cannot force hospitals to comply. That's why we met with the governor, and that's why we're petitioning and sending a letter to Obama, President Obama, to mandate these hospitals to follow the strictest guidelines in order to protect the frontline workers and healthcare workers. That will also protect the public. And you mentioned something about the California Hospital Association saying that they're ready and they feel that they're ready. You know, the California Nursing Association, National Nurses United, we disagree with that because it's like saying a fox is in a hen house and saying everything is going to be okay here. We know it's profit driven here and they will take the cheapest route. So that's why we're asking our leaders to use their executive mandate to mandate the hospitals to follow the guidelines, not just hospitals, but healthcare systems, because you never know, a patient may not come to an ER, they might go to a clinic.
And we've got to close it there. People can get more information on our website. Michael, Thomas, thanks so much for coming on the program.